Welcome to Arkansas First Reports, your trusted source for legislative updates from the Arkansas State Capitol. As we wrap up the fourth week of the General Assembly, our Legislative Liaison, Mike Shnaekel, has been closely monitoring several key bills. So, for a brief overview, we're here to discuss that today, right, Mike?
Yes, ma'am. Thank you for having me again, and thank you for all the listeners and watchers for tuning in and seeing what we're doing within Arkansas First, and please like, share, and subscribe with everything that we do.
That's right. Thank you. So let's start off with House Bill 1150. This is a bill that is introduced by Representative Moore and Senator Kim Hammer. This bill seeks to prohibit healthcare payors and pharmacy benefit managers, which are known by PBMs, from obtaining certain pharmacy permits. The intent is to minimize conflicts of interest and promote fair competition in the pharmacy market. Where are we at on this bill?
Well, that one's in its committee stages right now, and that one's probably one, we're seeing 1204 have worked its way through, and we're seeing a lot of pharmacy stuff for some reason in this session, when it comes to not-for-profit pharmacies, and now the House Bill 1150. I think this is going to be one that starts getting a lot of traction. You're going to start seeing on different networks and different people carrying it now, because it's going to affect how you receive your pharmacy care, your prescriptions, and quite possibly monopolize monetarily what you're going to be paying for products that you receive from pharmacies. So this one is one that is going to affect almost every citizen in the state of Arkansas, because at some point in time, most of us are going to receive a prescription from a pharmacy during our lives, right. And this will affect that.
And this really affects rural Arkansans. I mean, it really can have a devastating effect on rural Arkansans. I do want to point out that on our Arkansas First Review podcast, I did a segment with Fighting the Pharmacy Freedom 1150 and the battle against the corporate PBMs. It is a great podcast to go and listen to with a local pharmacist, Blake Torres. He is the co-owner of Westside Pharmacy in Benton, and just a lot of information that he put out that I believe our listeners are really going to want to hear in regards to this bill. So I do encourage you to please go find that episode and listen to it.
Yeah, and if I could real quick on that, I would encourage everyone, because when Candy's talking about a PBM, there's differences in pharmacies. Retail pharmacies. All pharmacies are retail pharmacies outside of the ones that are not-for-profit pharmacies. And there's a difference. Like Westside Pharmacy, they are not subsidized. They are ran by the people who own that are your local pharmacists, your local community that are working in these pharmacies. And I think it's very important that we continue to support them pharmacies, because they are the ones who gets out into the rural places. I know in Malvern, Arkansas, we have a pharmacy that delivers out to the rural area, because we have a lot of elderly patients that live in Hot Spring County. This is going to affect them and how they do business. So I would say pay attention to this. It's a bill that can get very confusing if you read it. And please watch Candy's podcast, because you're going to learn a lot when you take this bill and break it down to where people can understand it, because this bill is written and it's hard to understand when you first read it.
Right, and I believe that Blake Torres did an amazing job breaking down this bill and the pieces and how it affects Arkansans. So let's move on. Senate Bill 3. This was a big thing at the Capitol this week. It was introduced by Senator Sullivan and Representative Bentley. This seeks to prohibit discrimination or preferential treatment by the state and other public entities based on race, sex, color, ethnicity, and national origin. Tell me what happened yesterday.
Well, if you paid any attention to what was happening at the Capitol yesterday, we had some protest at the Capitol that started around noon, and it revolved around this bill, because this bill was introduced yesterday at the Capitol. And what this is this is Arkansas aligning itself with the federal policies of DEI and preferential treatment based upon race, color, creed, ethnicity. So this is one that is going to be it. I fully expect it to run through the House and run through the Senate and get out of committee pretty quick. Due to it's getting rid of the reverse discrimination right now, and we can beat it.
There was a press conference on this, and because it passed, and one of the things when we said yesterday, let's be very clear, because of when this podcast will be being uploaded, which was February the 5th, Wednesday, February the 5th. This had passed. There was a lot of rumbling around the Capitol just on this bill yesterday alone. Yeah.
Yeah. And I believe, and I think every American should feel the same way. We need to be hiring the best and brightest for every position, whether it's government, state, individual businesses, and we shouldn't have different hiring practices within federal government or state government than what we do on the local levels when a private business goes and hires. They go and hire the best and brightest for that position they have. And I'm not saying that there are some people that was a DEI hire to begin with that probably didn't morph into a phenomenal person in that position, just may not have the qualifications that others at that point. But this levels the playing field for everyone out there, and you're going to get hired. It's going to be a merit-based system, and I'm all for that.
I'm for the merit-based system as well. Senate Bill 189, this is sponsored by Senator Clark. It aims to authorize the sale of ivermectin for humans without a prescription or consultation with a healthcare professional, effectively classifying it as an over-the-counter medication.
Yeah, another absolutely great bill, but another one that's tied to pharmaceuticals. And we've talked about this a little bit off camera, and I've talked about this with other people. And I was in Garland County yesterday speaking at one of their events, and this came up and how I felt about it. Ivermectin has absolutely been proven to be beneficial for human consumption. I'm going to tell you, and we're seeing this, the pharmaceutical companies are going to fight this tooth and nail because this is going to affect them on some of the prescriptions that they provide that is not curing prescriptions. It has been shown now that ivermectin can be used for cancer. It can be used for COVID. It can be used for anything that is a parasite-based viral disease, that this will combat that. And the pharmaceutical industry I can tell you right now, does not like this bill because it is for Americans. It's an affordable prescription. It's an available prescription. It's being used now for human consumption, but they are going to fight that being an over-the-counter medication that's released. That one is going to be...
Right. Well, it was so demonized for COVID, right?
Yep.
Before COVID, it was a great prescription, right?
Yes.
And there was no issues with it. COVID happens. It's a cheap medication that helped a lot of people, and it was demonized as, a horse medication and so on. So we're going to keep our eyes on this. I think that this is a great bill, but I do believe it's going to get a lot of opposition from lobbyists.
Absolutely.
Right. Okay, now let's talk about Senate Bill 59. This was a bill sponsored by Dismang and Tucker. It mandates that beginning with the 2025-2026 school year, each public school student shall be provided one breakfast at no cost during each school day upon request, regardless of the student's eligibility for federal funded free or reduced priced meals.
Another bill that is great. I mean, I'm not a fan of federal money paying for things on 99% of the stuff that goes on in the United States, but this one is absolutely necessary. And I think it goes a little bit, it falls short in my opinion, because public schools, most of the kids that attend public school travel to school through the bus. The bus arrives, 10 minutes for the first bell, 15 minutes before the first bell. And a lot of these children that are out there, and look, let's just be honest about Arkansas's rural community. We are an impoverished state when it comes to our rural communities. And a lot of these children's meals, they only receive at school, or they receive a balanced meal at school. So it's imperative. And I love it that they're doing this breakfast, but there's going to be a lot of kids that are unable to make it to breakfast on time and then make it to the first bell. Well, I really think this should get amended in lunches, because we know every school in the state of Arkansas last year, and I know my school that I pay a lot of attention to, which is Glen Rose in Hot Spring County. Last year we had $7,200 in unpaid lunch bills at the school, because that is the meal that every kid should be entitled to. And I say entitled to because there's a difference at school that they should not be worried about a bill or, getting hammered by the schools in order for them to feed them. So I love this bill. I think it's phenomenal. It's something we need to do. We need to be focused more on our schools and in education and healthy students and balanced, nutritious meals at schools. So no, this one should fly through the House, but I hope they amend it and add lunches to it too.
Okay. Well, let's talk about one of the hot bills that has been the buzz this week outside of SB3. We've had House Bill 1204. This bill, put forward by Representatives Eubank and Evans, proposed that recovery of damages for past necessary medical care, treatment, or services should be limited to costs actually paid by or on behalf of the plaintiff, or that remain unpaid and for which the plaintiff or any third party is legally responsible. And this passed yesterday.
Yeah, this got through the House, I think 70 yes votes. It got through the Senate committee yesterday, which was, I think, a 3.5 hour.
It was a loss.
Senate committee meeting on this, because there is a lot of opposition on this bill, and there is a lot of Republican opposition on this bill, and there's a lot of Democrat opposition on this bill. Here's where I stand with that bill. Lawyers should be entitled to go into a courtroom and argue the case, and what it determines out of that courtroom is what it should be. The government should not be predetermining what happens with anyone in an accident, because this purely revolves around accidents. And it's really, the ones who are super concerned with this is the insurance industry and the trucking industry. And hey, I love both of them. They're both necessary means in the United States. But that's when someone has an accident and they feel like they need to get a lawyer, it must have been bad enough where it cost them time lost. And this affects how they get paid for the damages they have suffered.
Right.
And I do not believe that the government should be getting involved in lawsuits.
Yeah, I watched a lady yesterday who was speaking against this bill, really gives such a compelling, heart-wrenching story of what she went through with a wreck not even 3 years ago, and just one that, she's lost both of her legs, and just everything that she's gone through, and how this bill would affect her. And she did not want to get an attorney, but she was put in a position because the insurance just would not do the right thing. She had to get an attorney involved.
Well, and people need to realize, when you get in an accident like that, and that lady is a phenomenal case. She's unable to work. She is unable to perform the duties that she had in her life and the things that she enjoyed prior to this accident. And you're basically going to go in now as the government and say, well, you are only entitled to this little bitty sliver of benefits. That does, if there's no one should be supporting this bill. I don't care where you stand or what your thought process on, whether it helps insurance, doesn't help insurance, wherever it's at. That's what a jury is there for. No different than a criminal case. We're not going in and saying, they're not making acts to say, hey, well, this guy commits murder or maims this person, then he should only get 5 years because that's what we feel as a government. No, that's what a jury is for. That is what a judge is for. That is what a lawyer is for. Government needs to remove themselves from our lives more, not get involved more. And this act puts the government in control of lawsuit settlements. And I am not a fan.
Yeah. Okay, now let's move on to Senate Bill 142. This is known as the Bell-to-Bell No-Sell Act. This bill, introduced by Senators Dees and Hester, aimed to amend public school discipline policies concerning student use of personal electronic devices, restricting their use during the school day by enhance the learning environment.
Well, this bill on the surface sounds great, and I've actually had people reach out directly to me about this bill with their children. I like the fact that kids should not be on their cell phones during the day at school. There are some kids that are on IEP plans, 504 plans, and there's kids that are getting bullied at schools that their only resource during the school day is reach out and call mom and dad and say, hey, look, I'm getting picked on or this is happening. And I know some people firsthand that this has happened to that reached out to me and said, Mike, without my kid having a cell phone, I don't know what would happen to my kid at school because of the bullying. And look, I hate to point fingers at teachers and principals and things like that. A couple of these parents had some issues with the school directly. And
right, just go back to the interview that I did with Missy Botch a couple weeks ago, and you can find that on our podcast channel where I spoke with Missy Botch about what she's uncovering in the schools. This bill really is another government overreach and in controlling what parents decide what is best for their children. And so we're going to be keeping an eye on this bill.
Well, and with federal stuff that's happening right now, and I don't like to beat up Republicans, but we keep talking about where we've aligned ourselves with Trump policies and we're aligning ourselves with less government. That's what everyone in the United States wants, but we keep pushing these bills that puts them back in our kids' libraries, that puts them back in our schools, that puts them right directly in the classroom. It's got to stop. It just has to stop.
Right. Okay. Well, now we're going to be looking ahead. We know a bill that's coming up, and that is House Bill 1159. This is introduced by Representatives Richardson. This bill proposes the Retail Convenience Store Security Act, which would regulate security measures at retail convenience stores to enhance safety for both employees and customers. This, again, is huge government overreach and will greatly affect your small mom and pop stores.
This one, when you read it, you're like, man, yeah, that is phenomenal bill. It's going to increase security at stores. What people aren't realizing is they are wanting to dictate to all retail establishments where you need to have cameras, that you must purchase cameras, and it is going to burden these stores that are barely getting by, that serve communities, especially rural communities, because for some of these communities, you've got a Dollar General that is the only thing they have within 15, 20 miles of where they live. This is going to go into them and say, look, you must have all these security measures. And I'm going to leap forward a little bit on this bill too, because this is what's happened in Little Rock. Little Rock, with security cameras has now said, hey, we want all of these retail establishments to be available to the police department and available for us to watch 24 hours a day, 7 days a week. Well, that sounds great on the surface, but another burden, because then you have to have accessible Wi-Fi. You've got to be able to transmit it to it. And then what are you overseeing in these stores? What are you really paying attention to? Another one, government is getting involved in our daily lives, and they are wanting to completely take over the mom and pops. There is a lot of bills that affects mom and pops establishments.
Right.
This legislative session. And this one, when it comes up, I think it's going to be a really hot topic, and there's going to be a lot of kickback on that. And that one is actually being brought forward, I believe, by a Democrat lawmaker, which is kind of unusual for one of these bills to come out of that portion of it. So I hope this bill gets defeated when it comes up, because it is going to affect our cost of groceries at these stores, the cost of our fuel at these stores, everything, because they are going to have to raise their prices in order to be competitive in the community due to these burdens that are going to be put upon them. But yeah, this one's going to get a lot of traction when it takes off.
Yeah. So we're going to be keeping our eye on that. Well, that is our capital recap for the week, right? Mike, thank you for coming in today and keeping us informed. Stay tuned to Arkansas First Reports for continuous updates on these and other legislative developments. Follow our social medias, Arkansas First, and that's 1ST. You can get us on Facebook, Instagram, X. Make sure to subscribe to our contributors on ArkansasFirst1st.com. I'm Candy Cox, and thank you for joining us today.